Welcome to the Our Community Broadcasting Network, featuring the Family Medicine Best Practices podcast. Today's program will feature a presentation explaining the intricacies of the system of care for children's mental health. Providing this valuable information is Margie Grimsley, Executive Director of the Colorado Federation of Families for Children's Mental Health. Margie, welcome back to the program. Thanks for being with us today.
Hi, Dennis. Thanks so much for having me. I really appreciate it and this opportunity to kind of give my lens on introducing a system of care. It's really a pleasure to be here.
Again, you're going to give us a presentation on an overview of what the system of care is relative to mental health treatment and delivery. So why don't you start out by giving us kind of a definition? What is a system of care?
Well, and I'm going to start off, Dennis, by just sharing that I think I've thought a lot about this presentation and really how to present it in a way that people can really understand what a system of care is. But more importantly, I hope that this takes us back in time to really understand where we have been and then in time, and how do we, which will better understand what we're doing now in the present in regards to a system of care process. And in preparing for this presentation, I went back and found some old documents and some old things and was reminded about all the different programs and presentations that I've heard over time. And one quote I want to share with you is, because I think it captures in one sentence really what a system of care is. And it says, a system of care is first and foremost a set of values and principles that provide a framework for system reform on the behalf of children, youth, and families. And I think that's what's so important, because so often what we hear is how families can change. And what a system of care really is doing is how systems can reform to better meet the needs of families and children, both across the nation and certainly, of course, in Colorado.
Okay, well, why don't you give us your presentation on the system of care, and then I'll rejoin you after you're done.
Okay, thanks so much, Dennis. Briefly highlight what it is that we'll be talking about. And I'm going to try to give a brief history of system of care. And going back again, I want to listed the original definition and values and principles of a system of care, as well as at the end we will just highlight some possible directions that we will go next. And because there's so much to cover here, and there's a lot that won't be covered in today's slides, but we need to talk about. So moving on, I am now created this slide just so people would really understand that a system of care has a long history. It actually began back in 1982 when federally, I think across the states, people were recognizing that we really did not have a good system for children's mental health. So originally there was the CAS program that was created, and that's the Child and Adolescent Service System program. And Colorado was actually a recipient of the CAS dollars. It was a very modest amount of money. I remember Jefferson County was one of our CAS counties, and I cannot remember what the others are, but this was the way we in Colorado also started to really look at children's mental health in a different way. As time went on in 1986, we started that term system of care, and that was when that concept was really created and started to be planted in what was happening across the country. In 1992, SAMHSA, which we often hear about, we hear it in the news, and that's the Federal Substance Abuse and Mental Health Services Administration, that was created. And they, in turn, took over the work of promoting and ensuring that system of care were being implemented across the nation. I think one of the important things is from the beginning, a system of care approach included juvenile justice, child welfare, education, substance use and treatment, prevention services, early childhood programs, systems that serve youth and young adults in transition. So it had a its umbrella was very expansive, and it included areas that we originally did not, we saw more separately than we saw working together. I did want to make sure that we captured to really understand all of the system of care efforts that have happened in our state. We started with the first system of care grant, and that was called Cornerstone, and that had its juvenile justice focus. Project Bloom was an early childhood system of care grant. We have now since had 4 COAC system of care grants, and that was started with trauma-informed practices. So you can see that we have, in this state, we have had many system of care dollars come to our state to implement a system of care across our state. We've also had many offshoots, and in some cases, system of care grants that came to us that weren't the traditional. We had a Department of Education system of care grant that SAMHSA offered called Building Bridges. And that was the Department of Education worked directly with Mesa County to include that system of care model in their school process. We had Circles of Care, which was the Denver Indian Resource Center, received dollars to do that work. So I talked about defining system of care, and I gave that real short one-liner, but this was the actual definition that was in the beginning, and it was from 2010. And if you look at these key bolded words, you'll see that these really are the core components of what a system of care approach means. And it almost seems simplistic, but as we know, what's written on paper is often hard to implement. But these are really the core pieces of what a system of care is, and that it's an effective community-based and supports coordinated network, partnerships with families and youth. We address cultural and linguistic needs, and the key line here is function better at home, in school, and in the community, as well as throughout life. So this is, and it seems now we hear those terms, we think we're doing these things, but back in 2010, families were never at a table. There was a lot of work for us to get from this kind of model to where we are today. So the other key components are our system of care values. And these are the 3 core values, and they again have remained the same over time. When we talk about community-based, I think we have to think of that broadly, because what this has done is it's brought community partners, it's brought families, it's brought people together to really blend and braid their resources, how they fund the work collectively as a team. It's building bridges between agencies, nonprofits, places of worship. Everyone is looking at this, business partners. How collectively can a community really support those families and children in their community that need those resources? Family-driven and youth-guided, again, now we hear a lot about how families need to be at a table, but in the beginning, that was not a given. That was a rarity. So with this, we really are saying that families need to be part of the decision makers for their families and their child. as well as at the policy level and governance, both at the community and state level. Those were missing people at that table. It was done for families, not with families. And then youth guided is this again. This was when youth were engaged. We encouraged to be part of the process, to be at the table, because they in turn, it's their lives as well, and we need to hear their voices. The cultural and linguistically competent piece is really just the importance of connecting with people from various groups and backgrounds and making sure that we are responding to the unique needs of those members of different cultures in our community. It's very hard to understand what's happening regarding your child if you don't understand the language of which you're being asked to sign a paper, or if you do not understand what's happening in that room. So these were when the concept was being developed, these seem to be the three core values that are part of all system of care work. The system of care guiding principles, again, we could spend a session on each one individually, but this just highlights the importance of things that really weren't happening back in 2010. And we hope we've evolved so that they are. We hope we are using services and resources that are working. So we talk about evidence-based, we're saying this works, and whereas something else doesn't. Individualized, to me, is the most important. All of these things happen when we individualize the services and supports for that individual family and their child. So I won't spend time going through each one, but each one is equally important in its own right. And going down here to number 7, I think this one is unique as well, as when we talk about the developmental piece of this. A system of care really does look at what's the difference between a 3-year-old and a 3-year-old that's been assessed that maybe does need additional help because they're not behaving in the way that the other 3-year-olds are doing. We're looking at those, we're assessing those, and we're trying to figure out what does that child and family need. But then it's also very different when we're looking at that youth or that young adult that's transitioning into adulthood. For those adults transitioning out of residential, for example, and back into the community. There's so many pieces here that are all part of what a system of care model is. This slide really is to emphasize, and again, I won't go over each one, but it's that redesign at all levels. And what I think are the most important pieces, because I haven't touched on them previously, is to just make sure that we look at this one, because this is one that I know has happened to me personally, and I can't tell you how many times I've heard of it happening to families, as the primary focus was on what was wrong with the child. What's their diagnosis? Within a system of care, we always begin with what is that family and child's strengths. And to be honest, Dennis, sometimes it's very hard for that family to come up with strengths because they've been in such a difficult situations, and that team is there to help them identify what they see as the strengths of that family and child. That is so critically important in helping families really move forward and help them through some very difficult times. So I can't go through all of these different ones, but I think that it's important to recognize that in each case, there is something, we're moving from the way business as usual to a new way of taking care of families and children in the best way possible. So this one I focused on because I think this one is really something that's unique to that system of care approach that was being introduced. I can truly say that there has not been a time in the past where families really received and looked at as partners. But this is the piece that I think is so critically important, because this is a culture shift. And it's moving parents from feeling that they are the problem. And I think we can so look at that to recognizing within a system of care, parents are partners in this process. The judgment piece, I can't tell you how many times people, well, why don't they just do this? If they only did this, then everything would be okay. Professionals, so now we're looking at people and saying, how can I help you? How can I be part of your team? That's really the difference between judgment and being supportive. And that's what a system of care model does. The difference between parents as clients and parents as providers. Dennis, we now have family advocates. We have peer partners. We have so many people with lived experience now in the workforce. This is critically important because who better to be able to work with families who you have been able to share your experience with. That one, I think, is one of the ones that we really see a strong evolution, and we see a lot of that happening in Colorado. I put this slide in, and this is, I talked about that our different system of care grants. These are the guiding principles that COAC, our existing system of care grant, these were based off of theirs. And I'm not going to go over them specifically, but you'll see that the concepts are the same, even if the wording might be a little different. But it's a lot of what I've been trying to talk about is we really are talking about when we work with professionals and families, we're doing this as a team. We're not doing that as I can tell you how to do this. A piece that I think is important, and I keep thinking, Dennis, of the times that we've talked together and kind of thinking, what is it that a system of care is not? Because we want to make sure that there's not an expectation of what a system of care is that's not really within its parameters. A system of care is not an exact model. If I'm building a system of care model or approach in Mesa County, that's going to look different than it does in Denver County because those two counties are very different. What resources are available, what needs are. Some are the same, that framework is the same, but there's unique counties and unique families have different needs that need to be addressed. It's not a single program, but it's that network of services across agencies about those community partners. So we don't say, oh, I'm going to give you a system of care and that's going to include DDDD. It's not, because each program is who's at that table to build that partnership. Not a clinical treatment, not a treatment or clinical intervention. It's not saying we're going to give you 6 therapy sessions and then now you go away and everything will be well. What we're saying is 6 therapy sessions might be part of our system of our family plan, as well as making sure we understand there might be a case where this family is homeless or at the risk of being homeless. Pulling in that prevention piece, what can our team do to help prevent that family from being homeless? That's where flexible funds come in. There's unique components to a system of care that allow it to go from I can't do this to how can we help you do this. This is, I love the way this last part is system change plus practice change equals improved outcomes. And I think for many systems, it's oftentimes the cost becomes that key motivator. What we've recognized, and I think again with that data collection, is that there are improved outcomes which equate to cost. How much better to be paid using those dollars in a preventative way, in a supportive way, than to be using those dollars for incarceration, for homelessness, for lack of care. So I think this is as important as anything to recognize what a system of care isn't going to do and how it's different. moving on and just thinking, we had thought about what other podcasts can we do that we can be a little more a little more careful, more, we can describe better how a system of care works. One is certainly through that legislative lens, system of care lens, and with legislation. How is legislation really matching or including a system of care process in its in its intent? Evaluation, this is critically important. We have to be able to document and improve that families' lives are better, but at the same time, systems are also benefiting through this process. We can learn much more about the cultural and linguistic competence, how we can ensure that we're doing that, building partnerships so that we can do this together, and much, much more. So those were just some thoughts on what we can do to continue this conversation. I just want to end with this slide, and I think this is, because I've been doing this a long time, it certainly is my hope, is to imagine a time when we can stop talking about how to partner, involve, and engage with families, youth, and family-run organizations. And it is just the way it is. So that becomes our hope, that we don't have to work so hard to do something that will make such a good, positive difference for all.
Okay, Margie, that was a wonderful presentation. And again, just to remind people, all the stuff you saw in Margie's presentation is going to be posted on their website. All the links and resources, as well as the PowerPoint presentation itself. The initial podcast that Margie and Libby did with us is going to be on that. Future podcasts are going to be embedded on that, so that you can kind of go to one page and get an awful lot of information about the Colorado Federation of Families for Children with Mental Health, as well as the system of care model, which is very important. Comment I'd like to make, Margie, is one thing I learned from your presentation. You used the word partnering a lot. I look at that and I think in terms of collaboration, sharing information, how important that really is. And to have the parents involved to that extent. They're the ones on the ground. They're the ones that see what's going on day in and day out, and can be a valuable information source in order to have better outcomes. So to me, that is a major shift in a direction that I think is very positive.
You know, Dennis, what you've done is you've given me one of the podcasts that we need to do is really on how to share information about families responsibly. And one of the outcomes of our system of care work was there was a Colorado Children's and Youth Information Sharing whole process that we put together. And it really was to ensure that what information is shared about families with other entities is done in a responsible way. I can honestly say, Dennis, that when information is shared about families that maybe isn't always accurate or hasn't been done in a responsible way, that information can follow a family throughout all these systems, and harm can be done. So again, in all of these areas, we want to make sure that we are doing it responsibly and in a way that does not do harm. So that's another area that we can talk about in the future.
Right. Another big issue that I recognize from this is the adaptability. The fact that you can take this model, but you need to adapt it to the situation on the ground, as they like to say. And where it might work in one area this way, it needs to be worked a different way in another area. So the fact that there is flexibility built in, you're just really using the core principles to set a standard, and then you adapt it to the needs under certain circumstances, right?
Right. No, that's well said. Adaptability is critically important then, because each community has its unique components, its unique situation, and that needs to be understood and respected.
Okay, Margie. Well, I look forward to our next podcast as we get into more of the detail on system of care. And I welcome any questions that people may have and suggestions on future podcasts addressing this issue. So, and I'm going to put the website information up again as we say goodbye. So, thanks again for being with us.
Thank you, Dennis. Take care.